Chris McVeigh.
Yeah, hello. Hi, everybody. Happy Friday. Happy Friday before a Monday holiday. This is Chris McVeigh, and I'm the Director of Strategic Initiatives for DEED VRS. And we have the great privilege of two of our DHS colleagues joining us today for a conversation around Waiver Reimagine. So I am so grateful that we have their time to kind of walk us through the framework of the Waiver Reimagine and then what that's going to look like for some of the people that you're serving that are on waivers. My thanks to Alyssa Klein and Ann Macklett for setting this up. I know that Alyssa's vision was to have this presentation, and my thanks also to both Ryan Mers and Tony Gettenbein for putting this together for us today. So I love how we work together interagency, and this is one of the benefits of this interagency collaboration. So other than just welcome and happy almost end of the day and 3-day weekend, I'm going to introduce to you Tony Gettenbein and Ryan Mers from DHS and their Disability Services Division. I'm not sure, Alyssa, do I hand it off to one of them or to you?
I think they will take it from here. So thanks for being here, guys.
All right, and while Tony gets set up here, I know we got our presentation coming up, but just wanted to echo, this is Ryan Mers. I'm help with our employment services and do a lot. We've been having a lot of interagency collaboration over this past year, working with Chris, Alyssa, and Ann, and everyone. And so really appreciate the opportunity to be here today. I know we provided a PDF kind of statement around some of these changes that was sent out. So we can refer to that, but otherwise I'll pass it over to Tony to start sharing some of the information.
All right, thanks, Ryan. Well, the focus of today's training is that transition from day training and habilitation services and structured day to day support services. I'm also going to cover changes under the redesigned pre-vocational services. And it's my understanding people have seen this document titled Understanding Upcoming Changes to Pre-Vocational Services for School and Pre-Ed Staff. That was sent out at the beginning of January. And that's an excellent document, an excellent summary. And today I'm just going to take a deeper dive into that topic. So can you have the next slide, please? All right, so all the waivers are part of a so the need for the day service changes. So everything is under the HCBS, that's Home and Community-Based Service Standards. And that we have some federal and state policy developments that are requiring a transition of these services and supports for people with disabilities across the country and in Minnesota. And the Center for Medicaid Services has a HCBS rule that requires people with disabilities have the right and opportunities for involvement and inclusion in the community, seeking competitive employment, and working at jobs in community business. So this includes those HCBS standards. Okay, so I just read that piece of it. So why don't we go to the next slide? So where I thought I would start is that we understand where we've been. I think that most people are familiar with day training and habilitation, DT&H. And so we'll start off with what that service, the definition has been. And those are services that develop and maintain life skills for people with developmental disabilities or related conditions so they can fully participate in community life. Now, the employment services were removed from DT&H services by the 27 Minnesota legislature. And the DT&H pre-vocational service activities, I think are commonly referred to as, and in that document, as center-based work activities. So all of those center-based work activities moved to the redesigned pre-vocational services. Next slide, please. So a little bit more about DT&H. It's really skill development, helping a person achieve greater independence, productivity, and in community inclusion, increasing a person's physical, intellectual, emotional, and social functioning, It's can be coordinated with some of the communication, speech, and language therapies if they're indicated on the person's coordinated services and support plan, the CSSP. And that's really that person-centered document that really lays out what services a person's going to be getting from their assessments. And it also can supplement and support skill development that occurs in therapy, residential, or other community settings. All right, next slide. All right, so we're going to talk about day support services. So this is new terminology, a new service. So all DT&H will be streamlined into this new service, day support services. And the purpose of day service redesign is to simplify day services and create a day support option that makes service options easier for people to understand. So we'll see how well you can understand it. Next slide, please. So what are day support services? Well, they're included in the home and community-based services, and they provide opportunities for community-based training and support for people, for individuals with disabilities. And then you see those next two bullet points, enriching life skills and essential life skills. So we're going to dive into each of those and what those are, but it's to develop and maintain those enriching life skills so people with disabilities can fully access and participate in personally preferred, i.e. person-centered preferred activities in their community. And then also person-centered and provide individualized assessment and planning that assists people with identifying those essential life skills and discovering what some of those preferred life enriching skills are. Next slide. All right, so you can see, now we'll go into another acronym because we know we love that in our field. Day Support Services, DSS, is focused on intensive skill training and development that helps people achieve needed personal skills and community engagement skills. And it must strive to always teach and develop those essential life skills and personally enriching skills in the community. So that's a little bit of a shift now because we're talking about having some of those things offered in the community and not exclusively in center. And we must result in measurable and preferred outcomes as indicated in that person's CSSP, that individualized service and support plan. Next slide. All right, so these services will strengthen their community relationships, involvement, and inclusion. And they are part of the DHS, the 245D intensive disability waiver service that provides those individualized community-based training and support services to help people develop and maintain the needed essential life skills and personally preferred life enriching skills so they can effectively access and participate in meaningful activities in their communities. So you see those keywords, essential life skills and preferred enriching life skills. And so next slide, we'll start to drill down a little bit on what those actually are. Communication is one of those skills. So, and I think what the day support services do is this intensive training and support. So it's communication, community access, street safety, using private public transportation, and other various community resources. It also includes independent living. Next slide. It includes interest-based decision-making, money management and budgeting, health and wellness, positive behavior and mental health support, problem-solving, conflict resolution, and personal care. I told you I was doing a deep dive. Next slide. Self-direction and advocacy, social skills, therapeutic intervention, activities, and accommodations. So we give a lot of broad definition here about what those essential life skills are. And we can go into the next slide, which is about the personal enriching life skill learning opportunities. And that's here where we go into preferred volunteer experiences, connecting and teaching with various community resources, developing and strengthening personal relationships in their community, discovering and supporting the person's participation in recreational and fitness activities. Next slide. And they also provide learning opportunities and support. Okay, so this is again a deeper dive, establishing those informal supports in the community, exploring activities and discovering personal preferences, finding and supporting participation in a person's preferred educational training courses, identifying, supporting the person's participation in leisure and hobby activities, and facilitating opportunities and supporting participation in community and civic events that interest the person. So we really want to get the people out into the community and participating in the community. Next slide, please. Now, I think for today, we really want to emphasize some of the things that day support services do not cover. And that's paid employment in the community, that's paid work in a pre-vocational provider's facility, and it doesn't support people working at paid jobs in the community. So those are all no longer part of what was formerly known as day training and habilitation, and they are not part of day support services. So what about pre-vocational services? Next slide. All right, well, that's just my cover. All right, so here's the definition of pre-vocational services. Next one. Okay, these pre-vocational services, they prepare people with disability for jobs with competitive pay and help them achieve greater independence in the community. Pre-vocational services teach general work skills and concepts, not specific work skills for a particular job. Next slide. Now, because people can earn a sub-minimum wage in pre-vocational services, I'm assuming you're familiar with the Workforce Innovation and Opportunity Act. There's limitations about sub-minimum wage. So for example, before a person under age 25 with disabilities can earn a sub-minimum wage, they have to go through the pre-ETS process with VRS or with their school. So before you get to this point, I'm assuming that you're monitoring and handling the WIOA process that VRS administers, and that the person has given some informed consent about earning sub-minimum wage in pre-vocational services. Because if you are in pre-vocational services, you can earn minimum wage. You're not relegated to earning just sub-minimum wage. So if a person refused to go through all of this process through WIOA or pre-ETS, then they can't move into sub-minimum wage. And so this is where you see that any service so pre-vocational services, they can be in a provider controlled facility or a business. I think people are familiar with a lot of those businesses are thrift stores, or developing those essential work skills and strengthening a work capacity to meet the challenging task demands of work through meaningful work experience and vocational training that advances people towards competitive paid employment in the community. And I think that's a really important bullet point there, is that people are going into pre-vocational services because they have this idea, they have this plan that they do want to work in competitive employment.
Hey, Tony, this is Chris McVeigh.
Uh-huh.
Thank you so much. This slide really fits so well with the work, as you described, with WIOA and the work that DEED VRS has been doing since a number of these things went into effect in the 511 process. So I know we have a lot of transition counselors on the line, as well as pre-ETS reps and placement professionals. And Alyssa, I was just wondering if you might just quickly review the youth 511 requirements.
For me?
Or whatever you were thinking, we had talked about this previously. Is there anything you wanted to share along these lines?
You know, I really don't have much about the 511 process. I was really just planning to go over the pre-vocational. And so I
Sure.
just want, and I saw Alyssa raise her hand. So I just really wanted to make sure that, so that we're not just operating in isolation about here's pre-vocational and you're just moving there, but that there's all this preparatory work that needs to take place beforehand. And I'm really kind of thinking that, all right, so when you're making this, doing some of this preparatory work, we're laying about where you're going. So you've got a little bit of a roadmap ahead and you see, all right, if we're going to take this turn in the road, what does that mean? And I'll get into some of that. And I think the big change is that there's time limits on pre-vocational services. I'm going to get and drill down a little bit more into that.
You definitely hit it there. And Alyssa, I'll just hand to you and then I'll take it back for just a quick second.
Well, and we'll talk a little bit more. I know Ryan has some things he'll say too, but it doesn't change our process in terms of if an individual is interested in earning a sub-minimum wage and they're under the age of 25, then they still need to come to VRS in order to enter into pre-vocational services. And we still go through the same process. And of course, we had the welcome news for those that said, I don't want CIE, I want to go into sub-minimum wage, that we're able to determine them ineligible. None of that has changed. But the key thing to keep in mind, and we want to be informing families, is that if you're choosing that, you need to know that anybody that goes into pre-vocational services earning a sub-minimum wage, as long as it's in a center-based setting, that they have that 3-year limit. And I know Tony will get into that a little bit more.
Yes.
Is there
And so
anything more you want?
yeah, thank
Okay.
you so much, Alyssa. What I just wanted to share as well is since the 511 process began for adults ages 25 and older, we started with almost 16,000 people in our state in 2016 that were earning less than minimum wage or sub-minimum wage. We're in the middle of year 5. Amanda Jensen-Stahl and I keep, she tracks it consistently and regularly, but we're under 9,000 people at the end of year 4 that are earning sub-minimum wages. Now we anticipate that because of the pandemic and some other changes that I think a number of providers are making to their own to their business, to their the services that they provide, I would anticipate we'll see an additional significant drop at the end of year 5, which happens sometime on July 22nd of 2021. But just to give you a sense that there's been a significant drop since we started doing this work around 511 and making sure that people who are earning sub-minimum wages have the opportunity to say what it is that they want for employment. And we honor the fact when people say, I want to stay where I am. We understand that and we respect that. So anyway, I just wanted to give that as a backdrop as well. Thank you.
Thanks, Chris. I think we can move to the next slide. All right, so I'm going to drill down a little bit what these redesigned pre-vocational services are. If you think back to what I just talked about with day support services, some of these are similar services. So we're talking about punctual work attendance, increased attention to work tasks, work capacity and strengthening, work completion, increased work production, improved work performance quality, following work instructions, following work schedules and routines, self-direction and time management. You can go to the next slide. And this may include worksite transportation, mobility, safety, and street safety skills, workplace self-care, proper hygiene, grooming, on-the-job problem solving, effective workplace communication, social skills, personal relationships, relevant work-related educational development. And so here you see, when we lay out some of these activities, there's somewhat of an intersect between what is day support services and what is pre-vocational services. And so I'll go back to that common thing that makes a big difference is pre-vocational services are paid. Services in day support services are not paid. And so even though there's this overlap, That's where that key document, that person-centered key document is the CSSP, that's that individualized plan that's developed. And so which one of these will fall under day support services, which one goes under pre-vocational, that's where that's going to be sorted out by the team working with that person. Next slide, please. All right, so here's one of the big changes in redesign is that pre-vocational services are available to people eligible in all 4 of the current disability waiver service programs. And one of the things that we talked about, and I gave you a little bit of a heads up on, is we have these tiered eligibility standards. And so I'll emphasize that the 2 bullet points is there's before January 11th of this year, and there's after January 11th of this year. You know, if someone has received pre-vocational services, and that's including pre-vocational services under DT&H services, if they receive those prior to January 11th, they don't have any time limits. They can continue to receive those services as they have been. Now, if you're working with people new to pre-vocational services, now they have a time limit. It's 3 years or 36 consecutive months. And okay, there's something I did not edit. We originally wanted to have that lined up that a person needed to receive employment services or day support services in conjunction with pre-vocational services, but Center for Medicaid Services said we couldn't do that. So that's an error on there. It's one of the edits I did not make, but it would be encouraged. We just don't require that. I think it's a good practice to have people do that. So people can receive day support services and pre-vocational services on the same day. You just can't get them at the same time because there's different codes and you're going to have a different focus. And so then once again, that'll be laid out in that CSSP plan. Next slide, please. All right, we've got the exceptions, and I think this is a redundancy here, but if they received, now this is not that they had them on their service agreement, but they actually received those services. Because I hear sometimes we get questions, well, they receive services, but they have not been going there since the pandemic started. Are they under the time limit? And once again, if they received those services before January 11th, I'm just gonna sound like a broken record here, but then they don't have time limits. So I'm hoping that makes that clear. Now, the other second bullet point here is, okay, so if the person experiences, and I highlighted this in red, a debilitating physical or mental health condition that hinders their functioning, then they might be able to get an additional 12 months. So the time limits continue, but it could go up to 4 years if they experience a physical or mental health debilitating condition. Next slide. Another one of those exceptions to get that additional 12 months is a disruptive life event that significantly affects the implementation of pre-vocational services. And an additional exception is that they need to continue further work skills and training and development. And I know everyone has worked with some folks that they just need a little bit more time. But I think the intent behind these time limits is that we saw people that were in pre-vocational services, it seemed like in perpetuity. They just were stuck in one place all the time. Back in the day, I don't know if people still say this, but there was a term, pre-vocational is no vocational. And so this is really an effort to really just keep people moving and, and really focusing on that person-centered approach that we understand things happen, disruptive life events, people need more training, they have mental health issues. All right, we're not going to stick down to that 12 months or that 36 months, but you can get an additional month. And so those are options for people. And that really concludes my summary of what the redesigned pre-vocational services are. So I'll turn it back over to Ryan.
All right. Thanks, Tony, and thanks for running through. I'll capture this last slide here with questions as well. But I think Tony gave like a really good overview of the changes to day training and habilitation services and pre-vocational services occurring as part of the Waiver Reimagine with Waiver services. So now we have day support services and pre-voc. If you've got questions on some of that content, or as you're working through this with the people you're serving, we've provided our response center inbox there. So the dsd.responsecenter@state.mn.us. Obviously, the first place to go is working with a person's waiver case manager, because they're going to have that better understanding of the person's specific situation and what services they're accessing. But more of those general policy questions, or if there's something that you're having trouble resolving at that level, that response center inbox is a great place to go out to reach out for questions. So Anne, if you want to take off screen share for just a minute for the PowerPoint. I think where I'll try to go in following up Tony's presentation is talk about, how to think about these changes and what are some of the thoughts as vocational rehabilitation services counselors or as pre-vets representatives working with transition age students, how to think about or how this might impact your work. And as we mentioned, that document we sent out beforehand has a lot of great reference content that you can go back to. There's a couple of, there's a concise description of what's changing and then what you can do to support that work. In an overarching sense, I think what's really important to understand, one is that you're working with someone right now who's currently receiving waiver services. And as Tony mentioned, they've received DTNA, day training and habilitation services in the past, or they've received pre-vocational services in the past. They're sort of tiered in or tiered into those services. They don't have that same time limit requirement if they've been receiving those. But for people that are going to be new to receiving that service, so especially looking at transition age students right now, we really want to make sure that we're, as a system, kind of setting them up and setting those families up to understand, trajectories and employment trajectories, and really to understand that maybe sometimes in the past we've looked at pre-vocational services or day training and habilitation, that center-based work, as something where, if you're not employable, or that we made those type of determinations and people would go to those center-based settings and stay there for 10, 15 years as they work there. Really what these changes with Waiver Reimagine and what we're getting from our federal partners, CMS, and the direction with the final rule is just to emphasize that those pre-vocational services are to build skills so that people can gain the skills they need to be successful in competitive integrated employment. So it's a strategy to help someone progress and I get a little uncomfortable with this term, but kind of get ready for employment. And so really that's where the time limits come in, and helping make sure that people are building those skills and moving along the path towards competitive employment and not kind of getting sidetracked into a service. At the same time, so we know from the center-based work or from the pre-voc services connection that there are those time limits for people new to receiving the service, now, including students who would be graduating this year. We know that there's those limits on pre-voc. That doesn't mean that there aren't supports available to build out those other meaningful life activities outside of employment. And that's really where, when Tony was talking about day support services and, finding personally meaningful activities and enriching life skills, that day support services isn't time limited. It remains an option that can kind of wrap around employment. So when you're talking with someone and they're on their path to getting a job, there are supports available to build out the other parts of lives, getting involved in the community, being able to volunteer, finding the things that are important to that person and building out supports to help them get there. So,
oh, sorry, Ryan, this is Chris McPhee.
Yeah, jump in, Chris.
Oh, it's Ryan, not Tony. I really resonate with what you've just been sharing about the changes that, I think we as providers or counselors or connectors to individuals with the most significant disabilities, while Medicaid has pushed forward and encouraged some changes, on the Medicaid side, I would say that WIOA really has pushed us forward. The vocational rehabilitation program in serving and supporting people with the most significant disabilities. And that's why our transition counselors have really experienced a significant change in who it is that they're seeing and supporting, and connecting with students that they've never connected with before. And I think by bringing in the public VR program into classrooms, into places where those students are, and offering them options beyond just being just by getting directed directly into center-based employment. I think that there was a huge shift and change that Congress was looking for from the public VR agency with WIOA. And one thing that I just want to share, like how some of our community partners that are 245D licensed, those that have sheltered or center-based employment, what I've been hearing from some of them and how they talk to students that are coming in to their program into center-based employment for those pre-vocational services. And it's so encouraging, is that they talk to those students to say, you know what, we're so glad you're here. We have things that we want to teach you and support you in getting employed. That this is not a stopping point for you for the next 3 to 4 decades of your life. This is a place where you're going to learn skills, and we're going to talk to you about what you're interested in, and then find other opportunities for them, so that it's set from the very beginning of when these students and their families make a choice for center-based employment or pre-vocational skills, that there's an expectation and everybody's on that same page about seeing differently about what's possible for that person for employment. Also, as Tony, you're talking about day services, and that really a focus on the community instead of in-house. I mean, it's about enriching people's lives and seeing what's possible and going beyond what, our own lenses have been showing us for all of these years. So again, I just really appreciate the conversation today, but the public VR program, which includes VRS and SSB, we have an important part to play, really, from the time that those kids are in school, helping them think about what's possible. And then even if the decision is to go into day programming or center-based employment, that it's for a period of time, and that we can be part of that narrative as we're having those conversations with students and families. So thanks.
Yeah, I think that's a really good point, is that, and I think it's especially challenging for some of those day service providers, considering it's sub-zero and we have a pandemic, but you can make plans, and you can and start ideas and generating what are those person's preferences. And I also think that, as I was trying to indicate when I was doing that overview and showing where there's an overlap, that if you know that the clock is going to be ticking, well, then maybe you can work on some of those skills in day support services before you leap over to pre-vocational services. So I think as you're making some of those plans, and the people that you're working with, and you're looking at their trajectory, where do you start? Do you start with a time limited service, or you start one that doesn't have a clock on it?
Yeah, that's great. And I noticed just a process here. I noticed Alyssa put in a chat just for anyone. If you want to type in questions to the chat, send those in. I think we're entering a little bit more of our free form conversation as opposed to our structured presentation now. So if you've got questions on some of this content, send them in there, and we can just kind of address them as they come up in chat. Back to as a VRS counselor or a pre-ETS rep or working with transition age students, how to think about this information and support it. Is just, Chris mentioned the importance of the VR, the vocational rehabilitation services system, and working with people who have been receiving waiver services before this population. And I just think it's such a great opportunity as these changes are going, and helping connect that for our VR. You share this information with you all with the VR system, so you can help just really set up and have a better understanding of the different services and options under waiver services. So hopefully this information equips you just a little bit more as you're working with students and helping them build that vision for their life as they're graduating.
It looks like there is a question that came through. Just make sure I put it all here. So it looks like it's from Jennifer, and it says, if someone is on a waiver and agencies like RISE and others are unable to connect them with work due to the pandemic or loss of outside work options, can the waivers be used creatively to secure a work site that is more supportive than a typical competitive job?
So I guess when I'm reading that question and it says secure a work site, I can interpret that one of two ways. If it's a work site for the individual, because these are individualized waiver services based on a person-centered plan, you can use a waiver for that person. If you're going in another direction, which I'm not sure, which is a little vague, can the agency use that to develop a work site? That's not what waivers are for.
Yeah, and this is Ryan. I'll throw in there and add a couple additions as well. So if someone who's receiving waiver services, especially during COVID-19 and our pandemic, they might have experienced a job loss, and it's like, all right, what are the next steps? Like, what options are available? And I think there's depending on where the person's at and what they want to do, there's a lot of different supports that can be available. So, for example, part of that could be taking some more time to explore the work world and understand options that are out there. And so, this gets a little bit outside of pre-voc or day support services, but we also have a waiver employment service called Employment Exploration Services. So if someone's so there's supports that will help someone to kind of see, hey, what's out there? What can I do? What am I interested in a general sense around employment? And so whether through that exploration services or through some of the upcoming changes that we'll have to our employment development service to create a planning phase for that, there's supports available through the waiver for sort of some of that front end stuff. If someone loses their job during the pandemic and they're like, hey, I need to go get another job, but I want some support in doing that, I think that would be a great time where engaging vocational rehabilitation services and helping with that job search and get going. So there's, if it's I want to find a new job, there's that option. And then thirdly, one thing, another, if you've got someone that is, they're looking at different options, I think it's really important to understand in waiver services, some of our distinctions are not based so much on minimum wage or sub-minimum wage, but it's really more the setting that the service is occurring in. So pre-vocational services is center-based settings. You might also have people who are participating in, what we refer to as like community-based work crews, or you might have heard of it like enclaves, and those they may pay a competitive wage, or they might use sub-minimum wages or kind of commensurate wages, and those are that community-based work occurs or is supported under employment support services, which is for any community-based employment. The supports are provided through that service, which also isn't.
But you can also provide those community-based services pre-vocational services in a community business, as long as that provider has a contract with that business and people are paid by that provider. So that's where you kind of, that's where the nuances of pre-vocational services and employment support services. And so it's important to understand that pre-vocational services are not just minimum wage. They are not exclusively in a facility-based environment. It's contingent on what's the relationship with that work site and the facility and who's writing the paycheck for the person. If they're paid for by the agency, that could be considered pre-vocational services.
And this is Chris. I think for our VRS staff, just to understand that where vocational rehabilitation comes in is when the individual, the person, is interested in competitive integrated employment. So if the person is in pre-vocational services, and that is either in center or on a crew and enclave, and they're satisfied with that work, that is not where VRS comes in. it's when the person is saying, you know, I want a job in the community where I'm earning at least minimum wage. And that working in the community is something where they're working in the community with or without supports, but it wouldn't be in a crew or an enclave setting. It would be an independent work site where the person, again, may be getting supports ongoingly. That's entirely possible. Or they may be able to work without, you know, consistent supports required. But that it's really our focus. VRS, the Public VR Agency, is all about competitive integrated employment.
Great, thanks. That's a super good point to make, Chris. And I know one other question that comes up a lot, and I bet people are interested, is on some of the rate differences between these different services. You know, are there, as far as what a provider would be reimbursed for providing that service, are there differences here? And so just a quick mention on that. So for pre-vocational services, I think we could go and find the rate frameworks to have the actual, because the way that they're structured depends on your area and some of those other considerations. But as far as provider rates, pre-vocational services, the rate didn't change along with these changes. Pre-vocational services maintained the same rate. I believe day support services maintained a very similar rate to DT and day training and habilitation services. So for those reimbursement rates, again, I think I really want to point to the rate frameworks, but it's similar. It's very similar. And then we also have 3 employment services: exploration, development, and support, that have their own rate frameworks that are aligned on 15-minute units. And those are slightly different, I think. Yeah, I think so. I know there's been rates questions, so I just wanted to address that.
Looks like we have another question that came through. Or Alyssa, were you going to say something before putting that question out there?
Oh, I was going to go to the question that came through.
Okay. Okay, because it looks like it could be something that you might respond to, right? So I'll read it real quick. So do we have to complete 511 paperwork for those under 25 for this? The situation was referenced. And also, do we have a list of programs that offer pre-vocational options?
I can answer the first part of the question. Do we have to complete 511 paperwork for those under 25 for this? Now, keep in mind, as they said, pre-vocational services are limited to more the center-based training, and it may or may not be in where they're earning sub-minimum wage. So we look at the sub-minimum wage portion. So I would say a good portion of those that go into pre-vocational probably would be paid sub-minimum wage, not necessarily all, but a good portion. So the answer would be yes. For them to do that, we would still have to do the paperwork for Section 511 for those students or those youth who are under the age of 25. If they're 25 and older, we don't have to do any of that paperwork. And then a list of pre-vocational options. Maybe Ryan can answer that one.
Yeah, great, Alyssa. I'll try on that one. Tony, if you've got a better list, you jump in and correct me. What I will typically, I'm going to put it in the chat here. We have a licensing lookup service through DHS that you can use to find people who will have pre-vocational providers who have pre-vocational services on their license. And so you can kind of get a sense of the different service providers delivering pre-vocational services through waivers. And so that can help get you a sense of what's available. There's also minnesotahealth.info, which is a good place to see providers. And I think it gets a little bit more of the location of where they're at, and we can look up info. But those are the 2 tools I use: licensing lookup and that minnesotahealth.info.
Yeah, they need to have that 245D licensure that I had talked about earlier, and that would be listed on their licensure. I think really the part of that is that you work with the case managers, and the case managers have access to the tools that Ryan was talking about. And so I think it's working with the team and looking at those resources. That is a good approach to that. So there's a number of those resources where you can find that information.
I did also want to make a comment because that whole piece, like Ryan said, he kind of shuddered a bit to say readiness, to build work readiness skills. And I know this is obvious, but I just felt like I had to say it is, you know, obviously individuals don't have to go into pre-vocational to be ready. If individuals want to, you know, go, they're in school, for instance, those who are in transition, they want to work in the community, we wouldn't say, no, you're not ready, go to pre-voc first. We don't, it's for those that really that feel they want that and they need that, but we want to encourage CIE, competitive integrated employment, and support that as much as possible. And even if individuals might have some barriers in the way, that's where we can come in and try to help them overcome or work through those barriers in order to obtain CIE. So.
Great. And I want to circle back just real quickly, if we can. I'll try to share my screen here, and I think I've got the ability to share. I want to go into that licensing lookup just so you know how to find those providers, because it might not be as intuitive. Or I can save you some time trying to figure it out. So if you go to that link that I provided, this is the screen that comes up, and it allows you to search for service providers who are licensed through DHS. So you could search by name, you could search by what city or zip code. But basically what I want to emphasize is this licensing type. If you go here, you'll see there's different options, like it's, you know, foster care, detox services. We're talking about home and community-based services. So if you click on that, you'll see these boxes drop down that help you kind of further refine that. So you could either search for providers who have our competitive employment or our employment services on their license, like development, exploration, and support. Some of those I was mentioning, or those with day services, and this includes pre-vocational services. So if you clicked on this one and did a you know, active license only, you'll see a list of you know, and again, you can filter by your area of providers that have that enrollment or that license in your area. So just a little bit, if you want to use that link, that's how you can get to that information.
Thanks for showing that, Ryan. That's super helpful to see, to be able to walk through that. What other questions do people have? Again, feel free to use the chat, or if you do feel comfortable unmuting, that's okay too. Just we'll just watch if more than one does that. But feel free. And we know we are on a Friday after lunch. What other strikes do we have against us on people's attention and focus? Oh, you guys have been great though.
Yep, and this is Ryan, and I know I'm also conscious of our time, and I'm looking at where we are getting to. And so just one thing I want a little bit of a side topic, but wanted to get out there, especially with our E1MN state agency partnership to advance employment first outcomes and the collaboration we've been having with DEED, you know, VRS, SSB, and with the Minnesota Department of Education. I'm just so excited to have this opportunity here today and be able to kind of increase that understanding of our different programs. And I know we're conscious about making sure that, you know, VR counselors and staff are getting information they need about you know, how do waivers work? How does all that function? So that you can all do your jobs and help people get those jobs, and build that, you know, that positive employment trajectory and find meaningful employment. So I really just appreciate the opportunity to increase the understanding and hope this information is useful as you're doing your work.
Thanks for that, Ryan. I couldn't agree more that there's a lot of really good synergy that's going on between our agencies. And I will say that having been a counselor for a number of years, that this is a world around waiver, around day training habilitation, that prior to WIOA in 2016, VRS didn't have much of a touch point. And that young folks that were heading, or had more significant disabilities were automatically just moving right into day training and rehabilitation centers. And I remember many conversations with county case managers just saying, well, you're responsible because we know where they're heading, and it's not employment in the community. And so, I mean, again, I just see this, while this is really hard sometimes to like take in all of the new information, people are going to benefit from the work that we're planning and that's going on. There's going to be more people with disabilities working in competitive integrated employment. I just see a lot of really good things happening for people with disabilities, making more choices for themselves in all aspects of their life. And everybody who's on this call or in this meeting, you're part of making that happen. And so thank you so much for your time and attention. This will not be the last time we're going to talk about this. So if it's like overwhelming, like what, you know, it is a recorded session, but I have a feeling we'll have lots more opportunity to bring this topic forward and get people's questions answered as they come.
Looks like we might have one more question coming in too, if that's okay. I think we have just a little bit of time for Mike again. Are there people working with programs outstate to get this type of support in greater Minnesota? I looked at Blue Earth County and Waseca County, and unless it froze, there are none listed.
Yeah, that's a great, so that's a great question. So I wouldn't, you know, off the top of my head, I don't know specifically for Blue Earth County and Waseca County if there's providers doing pre-vocational services that are licensed in that area. But I think that's a good one. That's a good example of where interacting with case managers and with those lead agencies or those counties, because they'll have a better understanding of in that area, hey, where do people receive day services? Who's providing pre-vocational or other waiver employment services? I do know one of our big areas of work, at least on the competitive employment end, with VRS, is really trying to encourage and increase our shared provider pool for those employment service providers who are delivering the employment support services or employment development or exploration services, so that we can address geographic disparities in access and also make sure that people have more seamless transitions between our programs. So so Michael, quick answer to your question would be, I'm sure there are programs that are offering services to people residing in Blue Earth. But probably the best source would be the waiver case manager, would be to work with those counties or those lead agencies. If you're not seeing it pop up on the licensing lookup, they might just be licensed in an adjacent county. And then additionally, Ryan is never short. I am never short at words. But just for the rates conversation, I did provide a hyperlink to our rate frameworks. Again, caveat, they can get really confusing, but if you want to see what the actual rates are for those different services, that's kind of the go-to reference, is those rate frameworks.
Thanks for doing that, Ryan, and for all that information. Any other last questions? I know we just have 2 minutes left. This has been great information. I agree with Chris. I mean, there's so much that has changed over time, but some of these changes in the collaboration have been really great to meet some of the needs and how we can do so with the funds that need to help support it. So.
Well, I just did a quick lookup in Blue Earth County, and I think there's some nuances to figuring that out, because LifeWorks is Mankato, MRCI is in Blue Earth in Mankato, and so there are a number of those agencies there. So you have to do some deep digging, and that's why I think Ryan's recommendation was a good one, to work with that county case manager. They're more familiar with those agencies.
Yeah, awesome. Thanks, Tony.
Thanks, Steve. Well, with that, I think, I just want to thank everybody, Tony, Brian, Chris, and Alyssa for coming together today. I want to thank everybody else who was able to attend, really important information. And we'll get this recording out to everybody. If you have more questions, we'll make sure that the slide deck too is available so you have that resource information as well. So thanks everybody for attending. Have a great long weekend.
Thank you all.
Thank you, Tony and Ryan.